Congressman Barra, thank you so much for speaking with Voice of America Mandarin Service from your district.
Thanks. I'm glad to be on Voice of America.
How are your constituents coping with the pandemic?
I think like everyone throughout the country and around the world, staying at home is not normally what we do. We're an interactive species as human beings, but I think the people here in California and Sacramento County are really following those stay-at-home orders, and it does seem to be working. We've flattened the curve here in Sacramento County, and hopefully within the next few weeks we can start contemplating what reopening looks like.
You are in a very unique position to talk about the COVID-19 pandemic. In addition to being the House Foreign Affairs Committee subcommittee on Asia and the Pacific, you are also a doctor by trade. When and how did you first about that there is this mysterious virus outbreak in China? And as a physician, what was your first reaction?
As a doctor and a member of the Foreign Affairs Committee, one of my focus areas has been global health security and pandemic preparedness. So it's a small group of people, and really at the end of 2019 in December, we started to hear some stories, but really it was early January of 2020 that you started to understand that there was a novel coronavirus, a new coronavirus that was discovered in Wuhan. And then you saw the dramatic steps that China was taking in terms of quarantining an entire city and an entire province. And that's when we really understood that this wasn't like SARS or MERS. This was something a little bit different. That's when we worked with the CDC and others to try to get our scientists and doctors to the hotspot. Unfortunately, it was a little bit slow.
So 4 months later, we are now in a global pandemic. And looking back at this very brief time frame, what did you think that we did right, and what could we have done better in the United States?
The things that we should have done early, and my first interaction with the administration was on January 23rd, and the things we suggested at that time was we understood we would, our public health system would need additional billions of dollars. So we had made a request to say, tell us what you need, and we will do a supplemental bill at that time in early February, late January. In addition, we really should have pushed harder to allow our scientists and the global scientists to get into China so we could better understand what we were dealing with. That unfortunately didn't happen. And then, our own challenge with ramping up our diagnostic testing capability and, making sure those diagnostic tests were accurate and available to folks, that we should take some ownership over. That was a mistake on our part. But that led us to only one recourse, which was the mitigation effort, the stay-at-home effort to slow down the spread of this virus. And that's where we find ourselves right now.
You have been urging the Trump administration to create a national testing strategy and to widely and rapidly deploy antibody testing and contact tracing. Can you elaborate more on why it is so important to take these steps?
Yes, I don't disagree with the administration wanting to lift some of the stay-at-home orders, but we have to do it safely and when we have the resources to do that. So a national recovery strategy really is on a few pieces. One, we have to have the diagnostic testing capability. So we know this virus will likely be with us for another year, maybe 2 years. And in that time, we will continue to see clusters of cases. That requires us to quickly go out, test the symptomatic patient, make the diagnosis, and then do the contact tracing to try to limit the spread of that cluster. You saw South Korea actually fairly effectively applied that strategy early on when they experienced their first cases of COVID-19. So we can't think about opening up until we have the diagnostic testing capability. Second, we have to have the serologic testing capabilities as well. That's the antibody test that will tell us, if you were exposed to the virus, had the virus and recovered from the virus, and now you have some protection and immunity. That will help us make determinations of how many people in a community or across the country are actually safe and at very low risk of getting reinfected. And lastly, we need the public health workforce to go out and do the contact tracing, the testing, et cetera. We don't have that workforce, and we're estimating that could be up to 100,000 individuals that will quickly have to hire, train, and deploy around the country. That's also part of this recovery strategy. So we need to do all three almost immediately. So if we think about opening in 3 weeks, 4 weeks, whenever it is safe, then we have those resources in place.
So for many people at home and abroad, one of the most shocking things to see is that our doctors and nurses, healthcare professionals, first responders, essential workers do not have adequate PPE or personal protective equipment. What can the Congress and the administration do to ensure that from this point on, our frontline workers have enough of these PPE that they need to protect themselves from the virus?
I think what this pandemic has exposed is the global supply chain, and really how a lot of these equipments and personal protective equipment and some of the reagents for testing, et cetera, come from a single source, and that single source was China. And if we're so over-reliant on one country, then if that country, which is where the pandemic started, shuts down, that's going to have a ripple effect all across the supply chain. And I think that's something we, as not just the United States, but the global community, will have to discuss and look at as how we build redundancy. In the immediate term, though, we have to ramp up our own manufacturing capabilities, make sure there's plenty of personal protective equipment for our first responders, our doctors, our nurses. But then also, if we don't have the testing reagents and the test kits, we should be ramping up and manufacturing our own as well. Again, that's to deal with the immediate crisis. Longer term, we really will have to take a close look at the supply chains of not just protective equipment, of testing equipment, but also of pharmaceuticals, because you have to have redundancy in the supply chain.
So everybody now, and you mentioned it before, that everybody is now talking about reopening the economy and how and when to do that. What signs would you like to see before you can comfortably say, let's reopen the economy?
So the metrics we have to look at before we can say it's safe to reopen the economy is hospital admissions. So the number of people that are showing up at the hospital and are sick enough to be admitted. The number of people who are in the hospital who are being admitted to intensive care units, ICU admissions, those are two very important metrics, which as long as those numbers are going up, we know that the virus is still spreading across our community. Once we see those numbers go down, we still may continue to see the number of new cases go up, because as we ramp up testing capabilities, we certainly will be making more diagnosis. But, and we still may see the number of deaths continue to go up, because that's the indicator looking back about 2 weeks as to where the community was. But once we see hospital admissions and intensive care unit admissions starting to go down, then we can say, well, maybe we're past this curve and we are on the downward side. We still will want to wait 2 weeks to make sure that there's not another recurrence or spread of the virus. But that seems to be the life cycle of the virus. And if cases come down, hospital admissions come down, ICU admissions come down, after that 2-week period, you can say, you know what, we may be ahead of this virus, and let's start thinking about those other measures of letting certain parts of the population that are less vulnerable return to the workforce, or at least start opening up some additional activities.
What message would you like to send to the Voice of America's worldwide audience at this moment during the pandemic?
To the folks that are watching on Voice of America, this pandemic is a wake-up call for all of us, both as a community, as the United States of America, but really as the global community. We're all connected. We are all in this together. This pandemic will impact all of our lives in many ways. But if we stick together, if we stay as a global community, we will come out of this stronger and more resilient, and hopefully in a better place. And if we learn from this, we as a world will work together to prevent the next pandemic. We will work together to try to address the issues that this pandemic will expose, like vulnerable populations, et cetera. And it is my hope that we can come out in a more cooperative place as a planet.